Month. It's American Heart Month. We have Kristen Allen live in our First Alert newsroom this morning. Kristen, so important, and heart disease really impacts so many people.
It really does, Tammy. Actually, almost 50% of Americans have at least one of three key risk factors for heart disease, according to the Centers for Disease Control. And those include things like high blood pressure, high cholesterol, or smoking. But there are preventative measures that you can take. According to the Centers for Disease Control, the most common type of heart disease in the U.S. is coronary artery disease, which affects blood flow to the heart. Decreased blood flow can cause a heart attack. Symptoms of a heart attack can include chest discomfort or pain in the upper neck or back, and shortness of breath. Fatigue. Risk factors for heart disease are things like diabetes, being overweight, not being active, and excessive alcohol use.
Well, it's a major cause of morbidity and mortality in our country, and much of it is preventable. So with lifestyle measures, avoiding cigarette, nicotine use, changes in diet, changes in inactivity. There are relatively easy things and cheap things that we can do that can dramatically affect the longevity.
And while being inactive and obesity do put people at higher risk for heart disease, but things like blood pressure and high cholesterol can be genetic and happen in people that otherwise appear to be healthy and without any symptoms. So that's why doctors are encouraging you during this time to make an appointment with your primary care provider and get it checked, because it can be life-saving.